Dr. VanDyke here, board certified endocrinologist, back to talk more about why thyroid nodules develop. Sometimes we don't know why nodules develop, and we've talked about this a little bit in that some people make none, some people make one, some people make so many their thyroid might look like a bunch of grapes. So really when we're talking about who might make thyroid nodules and who wouldn't, there's a familial consideration. If thyroid cancers are in the family, then we're worried about maybe somebody making nodules that might be cancerous, because there are some kinds of genes that potentiate thyroid cancers. For example, the RET oncogene is one of them, and there's a bunch that we can test for when we do a thyroid biopsy. um, Otherwise, we think about other risk factors, people who have worked jobs that expose them to radiation, people who have had radiation treatments for other kinds of cancers in the chest or the neck or the head, or people who've lived in places where they have environmental exposure to radiation, like the folks who lived in Eastern Europe back when Chernobyl had its accident, or people who lived near the atomic testing sites in New Mexico. These are all people that have risks for making nodules and have risks for making cancer. So we're going to keep going in our discussion about what thyroid nodules are, who's at risk, how often we find cancers, and what we do about thyroid nodules, whether they have cancer or not.